So, okay, Ria, welcome for the mock interview.
Yes,
We
sir.
are doing it for gender and health IIT Hyderabad course.
Yes, sir.
What's the full form of this course? Like the full name of this course?
So, health, gender, and society.
Okay. And what are you expecting to learn here at this course?
Okay, sir. So through the course, during my research in fourth semester, I figured out that the alma mater declaration that was adopted by the country to improve the primary healthcare services, it has been adopted so narrowly that the impacts are seen at the ground level. People are not able to access public healthcare systems, and most of the times they don't even know what PHCs and CHCs are. So throughout this course, I want to experience and I want to learn what are the complexities of the health system and what are the different differentials, because the course also includes health and society as two differentials. So I want to understand how they function under the umbrella of health and how they're all interconnected.
Okay. So have you read any literature about this or any ongoing research
Yes,
uh,
sir.
which is happening in India or abroad?
Oh, yes, sir. I have read a paper written by George Matthew, under which he tried to explain what the fragmentation of healthcare services does in reality. The fragmentation that exists in practicality leads to the breakdown of the complete machinery of the public healthcare system. So, so the burden is entirely placed upon secondary and tertiary level healthcare, and the primary system completely fails because of lack of funding, and also because lack of awareness among people. So that is what the paper tried to explain. And I also read about an NIH research which was published in 2022, and it tried to explain how the issues that women face. So they took up the gender differentials, and they're trying to explain that the issues that women face in their real life and related to their health, they're completely underfunded and they're under researched in the academia spaces, and that leads to a lot of disparity among the treatments. And also a lot of clinical trial participants are men and not women, so that is also a differential.
Okay. So what you would like to do ahead, like the course that you are doing will give you what kind of career or what career do you think for yourself?
Okay, sir. So I initially applied for masters in social work for public health in TISS Mumbai, but I couldn't get in. So this was the second best option that I had, because as I told, it is an interdisciplinary course which is comprehensive in its entire package, and I want to step into the discipline of social or community medicine. So this will act as a medium for me to learn the theoretical.
So Ria, you should start your answer from this line only, because I did not ask you that have you applied somewhere or not.
Okay, sir.
So when I'm asking, and you also said that the TISS MPH course was the second best alternative, or this course was second best
Yes,
alternative.
sir.
So you should not tell this
Okay.
it's not second best alternative. It's going to the same goal,
Direction.
but
Okay.
with different path. Okay.
Okay.
So start with the line which you're telling right now.
Okay, so I want to work in the social and community medicine space, and this course will act as a bridge in learning the qualitative research and quantitative research methods and other things about the variables of gender and health, which will be helpful in my future.
And also talk about that the use of the same knowledge in policy making and execution of the policy which is
Okay.
being created by government of India. Make yourself applicable, and
Okay.
also you can put something for the space of research. Like I'll also keep on
Okay.
researching on
So
different
can
idea.
so
You should
can
also
I
add.
say that I want to do research in the field of primary healthcare at the
Yes, yes,
sub-doctorate level?
not like ऐसा नहीं है कि research आप academic में जाके ही केवल research करते हो.
Hmm.
So earlier I was talking with someone कि एक time था, or there was a time when people who were practitioner were also researchers.
Yes.
अभी क्या हम लोग we distinguish these two entity है ना, कि आप अगर आप प्रोफेसर हैं कॉलेज में इंस्टीट्यूशन में, then you will be doing research, और आप प्रैक्टिस कर रहे हो तो you'll be doing practice. ऐसा होना नहीं चाहिए. बहुत सारे ऐसे रिसर्चर्स हैं जिन्होंने on ground with practice they have conducted the research. So ultimately research के लिए क्या चाहिए? You need research skills, all the research method or tools you need to know, and you need data. तो जो फील्ड पे है, he will be able to get more empirical or more, I'll not say more empirical data and more valid data for the research.
Okay,
So you
sir.
can say you can pursue both, है ना, and you can keep on changing from research to practice, practice to research. कई सारे इकोनॉमिस्ट होते हैं, you know them, जैसे कि ऊपर कभी इंडस्ट्री में जाके जॉब करते हैं, and like you know रघुराम राजन. So वो
Yes, sir.
कभी आरबीआई में है, कभी यूनिवर्सिटी में है, तो कब आरबीआई में आके वो रिसर्च परस्यू नहीं कर सकते थे. He was a practitioner here, and when he is in university, he is a researcher there. So you should keep that orientation कि मतलब you will be the part of this in the goal of achieving health equity in society across the gender, and by doing practicing and as well as researching it,
Okay, sir.
because there's a lot of depth to be gained or understand, and we need to do more and more research or awareness bhi chahiye, not only in society but also among policy makers and गवर्नमेंट के डिफरेंट जो स्टेक होल्डर्स हैं उनको भी पता होना चाहिए, एंड ऑल्सो द रिसर्चर्स जो मेडिसिन पे रिसर्च करते हैं.
Yes, sir.
ठीक है, तो यू कैन मेक योर गोल लाइक क्वाइट बिगर, and you can think of after 10 year down the line or 15 year down the line what would be doing. Okay. Okay, so next question for you is like, do you know any policy? Well, I'm asking two policies. One, where you see that the gap which you are talking about, and
Yes,
in policies which government or researcher does, so that there is no equity of health among the gender.
yes, sir.
So do you know any policy which where you find this is like this is a gap there? And do you know any policy which actually tries to fulfill the gap?
Okay. So, sir, a policy that I find to be more not like comprehensive in its nature is the Janani Shishu Suraksha Karyakram, where both maternal and neonatal care is taken care of. But the problem is that, as I mentioned, the fragmentation paper, the problem is that the institutions of India are completely dominated by the RM and CHA regime or module. So the complete focus is kept on the fulfillment of the needs of a mother and her neonate. This is a problem because a lot of the times, despite getting more focus, these RM and CHA services don't get implemented properly on the ground. No, perinatal care is not provided properly in the duration that it is actually required. And further, when we talk about the care of the child, it is really important that antenatal or prenatal care is given. But if that is not provided through the primary centers or primary level clinics, the mother is not able to achieve whatever the nutrients is for the child. So there are deficiencies in the offsprings. And a scheme that is trying to bridge it, I found out this observation that during my research, I found that a lot of women were really excited about the workings of Mohalla Clinic and also about the workings of Asha, because the Anganwadi Asha workers and the Mohalla Clinic workers were really supportive in providing women the perinatal care that they actually require.
Okay. Okay. I'll change the topic here. Do you know what is FGM?
FGM, no, sir.
Okay. Read about this.
Okay.
Surya, you could have pursued your subject, which is there in your honors part, psych sociology. So why you are not uh, why you're not going for MA program in sociology?
Okay, so I wanted to change my discipline. As I said that I want to enter into the discipline of social medicine or community medicine and the research work related to that. So that is the main reason that I wanted to change my discipline. And also I believe that my knowledge of sociology, it would be really helpful in understanding the culturally sensitive interventions that can be made. And also
ठीक है. I just ask अगर यहाँ पे तुम sociology subject के लिमिट्स को बोलते हैं ना, तब वो गलत होता है.
Okay, sir.
मतलब दिस क्वेश्चन और द प्रीवियस क्वेश्चन शुड हैव सेम आंसर
Okay.
which you gave, कि आपको उसमें काम करना है, and your subject of sociology will help you there, है ना.
सर
so
इसका
ठीक है.
ऐसे शॉर्ट सा आंसर ही रहेगा.
हाँ ठीक है, बट मतलब कम्युनिटी हेल्थ में जैसे थोड़ा करना क्या है ना, कभी टीचर ना पूछे कोई अगला क्वेश्चन तो थोड़ा बड़ा कर सकते हो
ओके सर.
आंसर में, कि ये चीजों का रिसर्च कर सकते
ओके.
हैं. सो सूर्या, so you are living in Delhi.
यस सर.
What do you find matlab related to the same topic that we are talking here from the subjects? Do you find any issue that is there near in your region or in your society?
Yes, sir. Definitely, I do. I have, when I Google, I usually get a list of PHCs and CHCs that are available within the 5 kilometer radius of my residence. But actually, there is no awareness or accessibility of these places because at the local level, the MCD people don't really promote these institutions, which is a very big problem, as the vulnerable population is forced to access private clinics and private clinics that are not even fully qualified to function.
Okay. And how much it is the problem with equity, the health based biasness towards gender. Uh, do you think that even the upper class has it?
Biasness towards equity, they definitely have, but they don't really face any problems related to it because they have more purchasing capacity. So they don't really face any difficulties other than COVID. We cannot definitely forget that period. But even that problems within the accessibility and equity were completely seen as the pathologies that the vulnerable population has to live with came into the center or to the limelight because the inadequate use of syringes, the underdiagnosis, and also along with that, the irregular uses of antibiotics are something that the poor in low income regions are always subjected to. But the richer people who are have more purchasing capacity don't really face such problems.
Okay. And what about their social stigma with any such kind of thing that is there in their society?
So social stigma related to what? I couldn't understand.
Related to like they have this biasness towards the health of male gender more.
Okay, sir.
So
Okay.
is it there, or have
Yeah.
you ever realized it?
Yes, sir, I definitely do because sometimes men or the male population, they don't really place an importance on whatever the woman or the woman who's working outside or is a housewife, whatever her occupation is. They usually face double the burden of taking care of the household and also earning money from the outside. And even if they're not earning money, they're taking care of their kids. So that is in any way a burden that is more as compared to men. But men don't really place the same importance as to what the woman is facing in their day-to-day lives.
ठीक है, ये फिर भी ठीक है. अच्छा, इसमें एक चीज और है कि there are some inherited biasness towards health वो awareness which you cannot avoid, like जैसे क्या होता है कि the male population who are exposed to मतलब like pollution or the day-to-day activity that they do in their office, like work on computer and everything, तो उनके हेल्थ ऑटोमेटिकली उनके हेल्थ इश्यूज और वुमेन के हेल्थ इश्यूज अलग हो ही जाते हैं. एंड वुमेन हु आर लिविंग इन क्लोज कन्फाइंड एरिया, उनके मेंटल हेल्थ इश्यूज के प्रॉब्लम्स हो जाते हैं.
सर इसमें
तो
ये भी बोल सकते हैं क्या दैट एक पेपर में मैंने कहीं पे पढ़ा था दैट men are not able to access mental health services as frequently
हाँ,
as
वही यही
women.
चीज मैं बता रहा था कि कभी कभी तुम रिवर्स भी बता सकते हो कि इट्स नॉट अबाउट कि हम ऐसा सोचते हैं, कई बार नेचुरली भी ये डिफरेंशिएट हो जाता
Yes, sir. Okay.
है ना, तो उस पे भी बात कर सकते हो. चलो, लास्ट क्वेश्चन फॉर यू. Do you want to have you studied the curriculum that the college is providing?
Yes, sir, I have.
So what are the major learning outcome or major papers that you were interested in?
Okay, so I'm majorly interested in two courses that were anthropology of reproduction and disability, mental health and development. So under the latter paper, I was really intrigued by how uh, everything comes under the social justice umbrella, and how we study the idea of shared collective suffering, which is really important in a period of time where communal forces or political violence is faced by certain communities. So the importance of mental health and both disability comes into the picture.
Okay. Chalo, thank you.
Okay, thank you, sir.